we'll be talking about intrauterine insemination and donor insemination. It's just more of like trying to describe some terminologies as related to what assisted reproductive technology. So for the terminologies, for anyone that is they sound alike, we usually just describe them together. Okay, so for intrauterine insemination and donor insemination, they are both methods of what assisted reproductive technology, and they just have to do it placing the sperm directly into the uterus. So what is intrauterine insemination? It's just a fertility treatment. This one, sperm from the male partner is placed directly into the uterus. So when you're talking about donor insemination, it's just something related to that. So sperm is still placed in the uterus, but the sperm is actually coming from a donor, not your male partner. So process: ovulation is induced with fertility drugs. Sperm is collected and washed to concentrate the good sperm. Then they will now place the sperm into the uterus. Okay, so indications: when will you actually need to do an intrauterine insemination? If the male is kind of like infertile but is mild, so you can still collect their sperm, and if you put the sperm directly, it usually works. The cervical factor infertility, all those poor cervical mucus, unexplained infertility. So infertility is unexplained, so you just want to try to see if it will work. Okay, so what is donor insemination? It's just similar to the intrauterine insemination, but the sperm is coming from a donor, not your male partner. Okay, so the sperm has to be screened to make sure that there's no infections, there's no genetic conditions. Okay, it's prepared, then placed into the uterus. Okay, just like the intrauterine insemination. So when will you actually want to do a donor insemination? Is when your male partner is infertile. So if your male partner is infertile and you guys discuss and actually got to agree that okay, fine, somebody could actually donate, they're fine, they go for it. Then some women are single, and some women marry women. You understand? Same-sex couples, LGBTQ, Then also if the couples are at risk of transmitting hereditary disease, so you just collect from someone else rather than giving birth to a child that will be disabled.